people start to have better mobility, better coordination, better eye contact, better social interaction, better verbalization.
Millie, she has a rare genetic brain disorder. A large percentage of her brain was not present, was not developed. So it was a really severe situation. So we started working with her. We did some regenerative procedures. We did have STEMREGEN, and so we started giving her a half a cap of release. And everyone's been amazed. I mean, she's working on crawling now. She's vocalizing, she's talking. Wow. But there was a span, 6 or 8 weeks, where every week we were having a nonverbal autistic kid start to speak. And so I started to analyze that, and I'm like, they're all on STEMREGEN.
If you do have more stem cells in circulation, your body will utilize them for repair.
Whatever you're doing, if you pair it with STEMREGEN, you're just going to get better outcomes. Really, it's a no-brainer. It's been a big game changer in our clinical observations.
Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, welcome back to the Longevity Formula. Today is a fun day. We get to have an amazing individual, a highly intelligent individual, a pioneer, a trailblazer in the stem cell field. This is Christian Drapeau. You might recognize him because we've had him on before, and here's what happened. So many people tuned into that episode, and so many people have been trying the STEMREGEN product line that we have just been flooded with questions. And a lot of it has also been testimonies. A lot of people have said, man, thank you so much for doing that. That was so much information. We started using this product for X, Y, and Z condition, and we've seen amazing results. What about this? What about that? And we just start getting all these questions. And so we thought, hey, let's come together and let's have a little bit more clinical conversation about this amazing product line. And so today what we're going to do, we're going to flip it a little bit, right? And so Christian is going to actually ask me several different questions that are more clinically based. And so we're going to talk about the different demographics that we use the product in, how we implement the product, and what to expect, and all the different nuances that we as a clinical team get to see on a daily basis, right? So this is going to be an amazing episode for you if you suffer from some kind of chronic debilitating condition, or if you have something like autism or brain injury or chronic pain syndrome or any of that kind of stuff. We even dive into epilepsy and seizure disorders. So I'm really excited to have this conversation. Christian, thank you so much for joining us today.
My pleasure. Thank you for taking the time to do this, Brandon.
Absolutely. Thanks for having me. I agree. I think that a good clinical conversation is necessary for this product, right? Because of course, you want to use it for health and wellness. You want to use it for longevity. You want to use it for health span. All of that is true, and I use it for that. Mm-hmm. However, I am a clinician, right? I have multiple practices, and I see a lot of different types of patients. And anything that can improve outcomes for those patients and anything that is safe, we want to look into. And so when I started using the product line for myself, when my staff started using it, when my wife started using it, who's the ultimate use case, right? Because she's not going to use anything that isn't working. And she started to report back to me. I was like, okay, there's something to this. And so we started to blend it in with the clinical practice, and the results have just been amazing.
So let's dive a little bit into the clinical practice, because the product was developed, STEMREGEN, the line was developed from a purely scientific standpoint. Mm-hmm. Like, I'm a researcher, I'm not a clinician. So when it comes to translate all of this scientific information into a clinical practice, how do you introduce the product to the patient, how to use it, how to ensure compliance? I mean, it's a whole bag of information or know-how that I don't have, and that's why I would like to dive into a little bit on all that with you. Before we get there, tell a little bit about who you are, what you do, what's your clinic, because what you're doing is quite special.
Absolutely. So my primary licensure is chiropractic, and I have a whole backstory about how I got into that. I was going into neurosurgery, had a big faith-led thing happen to me. And anyway, I got accepted to pharmacy school, ended up going to chiropractic. It was a big God thing. I'm exactly where I'm supposed to be, but I knew I wasn't supposed to be practicing chiropractic per se. And so that led me into the functional neurology field. And so I ended up obtaining a diplomate in functional neurology and then furthered my studies and got a fellowship in developmental functional neurology with a focus in childhood neurodevelopmental disorders. And so my practice is all based around neuroplasticity. We are working with complex neurological disorders of all types. It'll be anything from moderate to severe to very severe brain injuries of all types, whether it's blunt force trauma, anoxic brain injuries, you name it, to severe autism cases, neurodevelopmental cases. I myself struggled with Tourette's and OCD as a kid, and then that is another driver of what led me into functional neurology, because nothing was really helping me. Definitely traditional medicine was not helping me. And even the holistic things I was doing was not helping, and I really needed to find balance within my nervous system. I needed to integrate and develop my brain in a different way, and that is what led me largely into this concept of functional neurology. And so within our practice, we also see some complex, really severe pain syndromes. I mean, people that are close to amputation because of their pain syndrome and these types of things. Seizure disorders. We were talking about seizures before we started this. I never set out to treat seizures. That was not even in my purview. It wasn't even on my radar. But because of all the different types of, specifically the brain injuries that were coming in, all of these patients were presenting with some type of seizure disorder. And then going through our methods, going through the different things that we do, a large percentage of people were reporting back, hey, seizures are improving. And so now that's one of the primary things that we work with are severe seizure disorders. And so we have this methodology that we've developed, and it's working quite well, and we're expanding it. I'm actually teaching a new version of it right now. But that's in a nutshell what we do. So it's a developmental functional neurology practice. Now, we also have to talk about photobiomodulation because that's the other side.
Just before we dive into this, so your top 5 condition, you would say autism, epilepsy, migraine?
So autism's huge. Seizure disorder, absolutely. Brain injury is huge. I mean, I've written a book about brain injury and brain injury rehab as well. I mean, I got very, very deeply entrenched in the pediatric brain injury space, especially. After that, chronic pain syndromes. So that's any type of chronic irretractable pain syndrome. That can be CRPS, that can be migraine, that can be any of those types of things. So those are the primary demographics that are walking into our office right now.
Mostly children.
Heavy children.
Okay.
We still work with adults, right? And it kind of varies, right? So it's summertime right now. So our demographic shifts, more 60, 70% pediatric. Once school starts back, then we'll be closer to probably 60-40 heavier pediatric, maybe 50-50 at sometimes.
Okay. So now let's dive back into what is really your expertise and a field in which you are, I would say, a pioneer, if not the pioneer, which is photobiomodulation.
Absolutely.
So say a little bit about it.
Yes. Absolutely. My passion has
How
always...
did it start?
Oh, gosh. Okay. Well, I was born in October 31st, 1985. But honestly, even as a young child, I was always fascinated with lasers. I just was. I remember I had a reconstructive chest surgery. I had a pectus carinatum, and it was pretty prominent, and it required surgical intervention. And I was in middle school. I don't remember how old I was. I was like 6th or 7th grade. And my parents, it was going to be a pretty extensive surgery. They said, we'll get you anything. Do you want a new video game? What do you want after surgery? And I said, I want a laser pointer. And they were like, okay, you're weird. We knew you were weird, but now we really know you're weird. But I've always had this fascination. So when I was going through my functional neurology training, I had the benefit of being mentored by the president of the Functional Neurology Board. And because of that, I got to see firsthand some really interesting cases. And one of them was a rare pediatric brain disorder. It was where the brain does not develop properly. And I remember working with him, I'm like, man, this is a genetic disorder. What are we doing? What are we going to do with them? And he said, well, we're going to shine a laser on their head. And this was probably 17 years ago or something like that. So this wasn't something commonly done. And I just remember thinking, man, this guy's crazy. And so,
and now you're the crazy.
Exactly. Even crazier, probably. And so we did. And that kid developed quite well. And I just remember going, man, there is something here. So that's when my obsession with photobiomodulation really started. And, in functional neurology, the big goal is neuroplasticity. So anything that can increase my chances of developing positive neuroplasticity faster, more effectively, more efficiently, I'm all in. And when you look at the research in photobiomodulation, you see upregulation of BDNF, you see modulation of inflammation, you see better blood flow, you see all these different metrics change that helps me to change a brain. And so it just made sense to combine something as safe and effective as photobiomodulation with the type of brain rehab that we were doing. And that's exactly what happened. We just started seeing faster results, better results, et cetera. And I started playing with it, and I thought, man, it sure would be better if we had these metrics in the laser, if I could control the duty cycle more with more granularity, or if I could really, really target and control these metrics, that I can't do this with other devices. And so I started talking to CEOs of laser companies and saying, hey, what if this, what if that? And they're like, yeah, it's a great idea. We're not going to do it, And finally, I was like, man, I'm just going to have to make my own. And so for the past 2 years, I did partner up with an amazing guy. His name's Kevin Johnson. He's a software engineer, has a really great background. He's worked on huge projects like CERN and other things. And we came together and we said, okay, there's a need, there's a hole to fill in the market. And we just started putting together a wish list of what do we want this laser to be, if it could be better than we could imagine. And we did that, and we built a team of engineers. And honestly, like the optical engineering team, they were like, Brandon, you can't take a laser with that kind of power and produce the safety class that you're trying to produce. That hasn't been done before. We don't do that. And we said, well, we're going to do it. And so so they did it. It took a long time, but finally through using 6 different diffusers and designing the optical system the way that we have, we've produced a very powerful laser, yet a very safe laser. And that was key, right? Because we want this to be strong enough for the clinic, strong enough for these really complex conditions, but safe enough for home use as well. And that's what we developed. So it's been a long journey. We're not done. We're still developing. We're still, even we were talking about some different iterations and things that we could work on further from here. But it's been very eye-opening and very fun.
So it's a laser that you can use different wavelength, you can use different intensity, you can cycle it and pulse it in different ways. And when it's all programmed properly, you basically just apply it to an area of the body. You work in neurology, so a lot of it is on the head, but you can apply it like on the head, on the vertebral column, different places of the body, and then the light essentially goes through the skin as an effect inside the body. Essentially, that's what it is.
Absolutely. And the wavelength selection, there's a lot of information that goes into that. Ultimately, a primary target for photobiomodulation is the mitochondria, right? And so we know we have the electron transport chain, and that's where electrons are passed from one complex to another, ultimately generating ATP, which is the fuel for our cell. So in chronic health issues, whether it be a brain injury or an autoimmune disease or whatever, right? Chronic health issues, you're going to see more mitochondrial inefficiencies. And so those complexes are getting further apart, and those electrons are not as efficient going from one complex to another. And so we need strategies that can improve mitochondrial efficiency. So when I use the red wavelength, right, we have a red 638 nanometer wavelength, this improves cytochrome C oxidase efficiency, so it helps actually carry these electrons more effectively through the electron transport chain. and it makes the FO head of the ATP synthase at the end of the electron transport chain spin at a faster rate. A healthy spin rate is around 7,000 RPM. As that mitochondrial inefficiency continues to progress, you get slower and slower spin, and so it slows down how fast those electrons are going through there. But then the infrared, so the invisible wavelengths, those can actually help increase the hydration of the cell. So that's important because we need to produce what's called structured water or exclusion zone water in our cell from our mitochondria. It's actually from complex 4. And this helps the cell heal faster. And you also need it, just to segue into the stem cell discussion, you also need proper hydration for proper protein expression, right? So you can, you have this this internal construction site going on, right? And your stem cells are driving that and helping develop new tissues and regenerating. But if you're dehydrating, you're not producing enough cellular water, right? Those proteins are not being expressed as effectively as they could be. So there's several different reasons that we need to do this. And in today's world, one consideration is all the exposure of non-native EMF actually dries up our ability to hydrate our cell. It's like putting a steak in a microwave. It dries it out. Well, that's going on in our cells as well. So there's other targets. There's I could go on for an hour here. But yes, that's what we're trying to do is drive cellular energy production more efficiently so that cell can do whatever it needs to do better and more efficiently. So if it needs to heal, produce a neurotransmitter, whatever it's doing, it's going to do it better if we get the correct wavelengths of light, and then we modulate that light even more, right? We, again, setting the duty cycle, the frequency, all of these different things is like modulating your voice. So you're talking to that part of the body more specifically and targeted.
Okay. Well, you've got tons of experience applying that laser in all kinds of conditions. But let's talk about what happened first, why you started to introduce STEMREGEN into the protocol, and the kind of result that you obtained. Before we get there, for anybody who is new to STEMREGEN, just a few words about what it is. So it's a blend of plant extract. So this is 25 years of work. A blend of plant extract that have all been documented to act in the body as stem cell mobilizers. So you take 2 capsules of STEMREGEN, and within about 2-3 hours, we can quantify using flow cytometry, roughly about an average of 10 million additional stem cells in circulation. So 10 million, you do this, let's say, once or twice a day for a month. Well, it's 300 to 600 million of your own stem cells that have been released. So the impact can become very quickly quite significant. We've added 2 additional products to this, Mobilize and Signal, simply because when stem cells are being released, they don't always reach the fine capillary bed of an area that has a chronic condition. Oftentimes you have a chronic condition, it does not repair, and yet the body continues to release stem cells naturally. So why are stem cells not going in that area to repair? Oftentimes the chronic nature of the problem has damaged microcirculation. So Mobilize is a blend of 4 technologies that are going to really improve and boost capillary circulation. The other product, Signal, is to reduce background noise. Inflammation should always be localized. It's released by an injury. It is calling for repair. It's meant essentially to attract stem cells to that area so stem cells can repair. But if it's not repaired for whatever reason, it becomes chronic, it becomes systemic inflammation, and that's noise in the bloodstream, and it kinds of sort of messes up with stem cells' ability to really identify where the problem is, where they need to migrate. So by suppressing this background noise, stem cells can better see where they need to go. And by opening the microcirculation with Mobilize, then we really give access to stem cells to all the areas where they need to go. So it's a protocol. We don't have to use it as a protocol, but essentially that's the protocol of release, Mobilize, and Signal. So in a nutshell. So how did you first got in touch with STEMREGEN? You talked about your wife and some people in your clinic using it.
Yes. The honest story is I was at, I think this was maybe it wasn't the last biohacker conference, maybe the one before. I think it was two conferences ago. Y'all were there. We were there representing the laser. And I'll be honest, I looked at it, I was like, man, that's just another product on the market. It's a beautiful product, like great, design and all this. And I was like, whatever, right? And then I kept on getting questions about it, like, hey, Crawford, let's look at this. Let's look at this. And I'm like, man, another product. I mean, as a clinician, like,
of course, I do the same.
Yeah, we get people in the office, we get emails, all this all the time, like, hey, free samples, like all this kind of stuff. And so I was a little skeptical just because I'm getting hit all the time, right? And so actually, it was Dr. Jerry Levine, you met in my office before he came over here. She's an integrative psychologist, and she helps me out with our regenerative medicine procedures. She goes, no, Brandon, look, they're claiming that they can increase your endogenous production of stem cells. Like, they're saying that they can make you produce more stem cells. And I'm like, okay, let's take a look at it. And so, I walked over there. I think I had a conversation with someone, started reading about it. And I was like, okay, this looks really good, and there's substance here. Like, you guys were not just throwing out, random claims and whatever, like a bunch of anecdotes. There was good science, there was good substance. And so I thought, okay. So I went ahead and ordered a lot. I don't remember what whatever order I did. And I always test it on myself. I test on my family, the staff, et cetera. We don't go straight to patients, of course. And, one of the first reports back was Dr. Jerry. She was like, I'm thinking more clearly. I feel amazing. My energy is up. My knee doesn't hurt anymore. Like, she was giving me all this feedback. And I'm like, that's amazing. For me, I've had more energy. I had more mental clarity, et cetera. But the one that really got me was my wife, right? And anything that has a positive impact on her GI system, on her gut function, I'm all in. Because that is a true testament to that product for me. And there's really two products that have had a good response for her, and it's STEMREGEN and Fatty 15. And those are the ones that she comes back and she's like, man, I'm never not going to take this. And so I was like, okay, there's something here. And so we started getting more and more reports from the staff and from all the people around me using it. And I thought, okay, we have these, debilitating conditions coming in. Why not upregulate their own stem cell production, right? And so we started to use it in the patient demographics. And one of the first demographics, and it's a larger demographic that we have, is autism. Mm-hmm. And so we started to use it with those patients. And I just remember, there wasn't anything like immediate, right? Of course, this is something that we're working with someone over a longer period of time. But there was a span, I don't remember exactly how long, 6 or 8 weeks, something like that, where every week we were having a nonverbal autistic kid start to speak. And I was like, man, this is great. Mm-hmm. And so I started to analyze that, right? And I'm like, they're all on STEMREGEN. They're all taking release. There's got to be something to this. And so that's been huge for them. But then also with our brain injury cases, we just see faster recovery, faster progress, whether it's mild, moderate, or even the really severe cases. We're just seeing faster rehab progress. The chronic pain patients are responding. Everyone is responding better, mm-hmm. right? And so it was one of those things where we just kind of dipped our toe in the water, and now we're neck deep because now we do regenerative procedures, right? We do a laser-activated plasma procedure where we're targeting the V cells, and it just made sense. It's like, okay, if we're using someone's own V cells, why not increase the count before we pull mm-hmm. their blood, before we produce the plasma? And so now, when you do the procedure, you come in the morning of, you take STEMREGEN. It just makes sense. Mm-hmm. And of course, we're getting better results. And we're telling people, if you continue to take this, and we tell them at least for 3 months, say at least commit to a 3-month process. That's what we tell them. You're more than likely, I can't guarantee anything, but you're more than likely going to see better results, faster results. And that's what we continue to see. With our dementia cases, because we do see various forms of dementias as well.
Not in children.
Not in children. No, this is older in adults. One of the main drivers in especially frontotemporal dementia is vascular. Mm-hmm. Right? We see vascular compromise. We start to see atrophy in areas like the hippocampus and whatnot. So one of the first things I'll do with those patients is put them on Mobilize. Love Mobilize for dementias and for, of course, we still want them on release. We still want them on, all the things, but that's been a great product for that demographic. Signal's interesting. It took me a while to kind of figure out a clinical use case for Signal. Of course, anyone with inflammation, right? I mean, essentially. But I have seen that people with autoimmunity seem to do very well with Signal. And I have Hashimoto's, and so I'm in that category. And so, we're starting to see different clinical pearls for each of these products. Now, what else, of course, have to say is everyone needs the release, right? Because that's the one that increases the stem cell production. And so with seizure disorders, right, and we were talking about seizure disorders, we're always slower. We go slower, we work slower. We don't want to cause transient increases. We don't want to spike seizures, all this kind of stuff. They've tolerated release very well. And if someone, listening has a severe seizure disorder, you know exactly what I'm talking about, where you can take, any kind of vitamin and it may throw your system off and you might start having seizures. But we've got people on release that have really severe seizure disorders, and I have not seen really a deleterious effect. I've only seen positive outcomes so far. I have not been able to see where it's causing a transient rise in spikes or anything like that. So it really is becoming that product where across the board, it's like, man, you want to heal faster? You want to heal more effectively? Let's get you on release. Let's get you using this product, because honestly, it has just produced better outcomes.
Do you have a case that comes in mind that would be like an exceptional case, just to give an idea of what it is that we're talking about here in terms of improvements?
Yeah. Well, the one that comes to mind is Millie. She has a rare genetic brain disorder. It's called lobar holoprosencephaly. And we started working with her before we had STEMREGEN. And we got results. We got good. I mean, she was, at like 6 months old, sent home to die, right? It was like, hey, go get on hospice. You're not going to see much. I mean, a large percentage of her brain was not present, was not developed. It was just void space in her skull. So it was a really severe situation. So we started working with her, started doing our rehab methods. We did some regenerative procedures. She did better than expected. When she came back to us, right, because we work with someone for a period of time, usually several weeks or maybe a month or something like this. We make a home care plan. They go home, they continue to do therapies, and they come back, right, once they kind of hit a plateau or whatever the follow-up strategies are. And so when she came back, we did have STEMREGEN at that point in time, and she was young. I mean, she was probably, a little over a year old. And so we started giving her a half a cap of release, and we kept her on it. And the jump in functionality was greater, right? That was, and everyone's been amazed. I mean, she's working on crawling now. She's vocalizing. She's talking. Wow. She was sent home to die. And if you look up, she was a severe case of lobar holoprosencephaly. This is not expected in this condition. So she's a great one that I can talk about.
Autism.
There's multiple. Let me say that much. There's multiple. I love the product for autism. It seems to accelerate the progression as we're working through primitive reflex integration. We get better, faster integration. We see better functional gains. And so we'll see improved social engagement. Eye contact happens faster. Reduction in startle reflexes and Moreau's and all this kind of stuff improves faster. The development of the vagal system happens faster. And then, like I said earlier, right, we have a lot of nonverbal cases. And I mean, look, I can't say put your kid on, this product and they're going to speak, right? Because we're doing multiple things. However, I do believe, just clinically, my own perspective, that as we have had more and more people with autism, nonverbal autism, on STEMREGEN, I have seen people start to speak faster. So I do think that there's a correlation there.
We've seen it. We don't have a study, but we have clinics that have used STEMREGEN, and the comments that we have had are people start to have better mobility, better coordination, better eye contact, better social interaction, better verbalization. We have a kid, for example, the father was sharing that one day the kid came back from school and there was a note from the teacher and asking the parents, like, what is different with him, because he's now starting to write and read at school, which he had never done before.
Yeah.
So those kinds of stories we get back, but I don't have a clinical setup to document any of it. So that's part of what we will start to do, start to document these cases, because we need to let parents know, because if it can really help their kids, I mean, we have to make it known.
Absolutely. And just to kind of, add on to that conversation is the safety profile, right? Because of course, that's always top of mind with us is, we can add something, but what's the risk to benefit ratio here? I have not seen, bad side effects. I've not seen any kind of thing that's like, hey, start taking this, but watch out for X, Y, Z. I haven't really seen that. The only thing, this is funny. So when I spoke to you, I think you were on my podcast, and I said, okay, as a pioneer in this space and developer of the product, how much do you take? And I think you said 6 3 times a day or something like that, right?
I did do that for a while.
Yeah. And I was like, all right, 6 3 times a day. So I started taking handfuls of release. I was jittery. I was like, I had a ton of energy, but I was like, oh my gosh, it's like I just did 12 shots of espresso. And so, I do tell some people that are more sensitive, hey, this is what happened to me. I got a little jittery. I reduced my dose. 2 3 times a day is a good sweet spot for me. If I have a really important meeting or I'm really tired, maybe I'll take 3, and I don't get jittery or whatever. But I've had the same report, right? I've had people say like, yeah, I took 4 and I got a little jittery, so I just take 3, So the safety profile is amazing. That's all I wanted to communicate is, if you're listening and you have an autistic kid or someone with, whatever condition, of course, speak to your medical provider. Never don't want you to do that, right? Always want you to communicate to your medical providers. But this is a really safe product to trial.
And I'm thinking as we talk about children, compliance is less of an issue. I'm assuming because you talk to the parents, and then the parents are oftentimes very motivated to do this with their kids. I'm assuming. So, if we want to see with practitioners, how can they make their patients, adult patients, more compliant? Like, what is, with your adult patients, what is the best way to introduce the product, explain it to the patients, and what have you done what have you found that works very well to make sure that they're compliant?
Okay, so yes, so for the adult population, they have to understand why they're taking it, because there's so many products on the market. I mean, we'll get people that are on 30, 40 different supplements and medications and all these things. So there is this need for education just to kind of break through the noise. And so I'll tell people, hey, look, this is like your own internal rebuilding program. This is your construction team, right? So if you're living life, you go for a run, well, you just cause some tissue damage, and you have these stem cells that are produced in your body that migrate to these sites and repair and rebuild, right? And I'll explain this from this perspective too. If you have a building and it's just there and people are working in it and whatever, over a period of time, say 20 years, 30 years, whatever, it's going to need some repairs. It's going to need, it's going to have some issues. So what do? You have a construction team that comes in and they repair it and they rebuild it and all this kind of stuff, right? Well, imagine as you age, right? We don't produce our stem cells as much. We start to reduce our production. And then if you have a chronic condition, there's some reports that say, hey, you don't produce stem cells as well, or maybe you need more, right? And so I just tell people this product line has been proven, and it actually does increase the number of stem cells flowing through your blood. So we're literally giving you more construction team members to go and repair your systems, right? So that's number one, is coming up with a good strategy to really educate the patient, because they really need to understand it. But number two, I give them a definitive timeline. I'll tell them, hey, I want you to trial this for 3 months. And I say 3 months, right? And that's just the time frame. Number one, it correlates with some of our regenerative procedures. But number two, I want them to have a long enough exposure so that, because what's going to happen is this: they're going to take it for 3 months, they're going to stop, or most people, right? And they're gonna stop, and then all of a sudden, maybe 2 weeks go by, 4 weeks go by, and they reach out and they go, hey, I felt a lot better when I was taking this product. Can I start it again? Absolutely. Because honestly, I mean, from my perspective, why would you stop, right? I mean, I take it every day. And especially if someone is healing from something or a chronic condition, autism, whatever it may be, why not take it on a daily basis and continue to increase your stem cell production, and then increase the ability for them to mobilize and to, not be so inflamed and all of these things. That just makes sense. And so from our perspective, the product does the work. We just have to educate the patient, and then we give them a definitive timeline, and then they start taking it, and then they feel the difference. I haven't had anyone, I mean, I'm trying to think right now, I don't think I've had anyone that took the product and they were like, nah, I don't like it. I didn't feel good on it, or whatever, right? We typically get some type of response from that patient, whether they feel better, they have better mental clarity, less brain fog, fatigue, pain goes down, whatever it is. They typically feel some type of progress, some type of result, which when you're dealing with these, more involved, more complex cases, the caregivers, whether it's a mom, a dad, nurse, whoever it may be, they're stressed out too. And so when we're talking to parents and caregivers, right, we're talking about the patient. I think we do a good job. We turn to the parent and we say, you need to be on this too. Because chronic stress bathes the brain in cortisol and starts to shrink all these networks. And how's your memory? How's your stress response, right? And they're like, oh, yeah. Well, what are you doing for yourself? Nothing. Everything's going towards my kid. Okay. And so we're getting a lot of parents and caregivers using the product too because they need it. All right. They have this crazy stress response, and they need support too.
How do you integrate, and again, it's probably more to your adult population because kids will technically need it less, but the inclusion of Signal in Mobilize, how do you integrate that into, who do you recommend it to, and how do you explain it and the protocol that you provide them with?
Yeah. I probably lean heavier onto Mobilize than Signal personally, but I think they're both fantastic. But I love Mobilize, again, because of the fuel for delivery problem. And what I mean is, when I'm doing my clinical exam, right, and I've developed this whole, from head to toe, we're looking at everything. One of the first things I check are the person's feet. And it's interesting, you can ask any of my interns, right? The first thing I do is, okay, take your socks and shoes off. And I start looking at their feet. And I'm looking for any kind of vascular compromise. Is there swelling in the ankles? Do I see varicosities? Do I see any microcirculation issues like little petechiae, little spider veins? Is there any pitting edema? What's the health of their toenails? Is there fungus? Is there overgrowth? Is there something there? What's the capillary refill time? If we have blood flow changes in the feet, I guarantee you have blood flow issues in the brain. And so if I see any signs of blood flow challenges, any kind of autonomic tone disruptions or anything like that, I'm leaning into Mobilize because, look, if I'm going to fire a network in the brain, it has to have blood flow.
Of course.
If you don't have it, you're sunk. You're not going to deliver your oxygen, your nutrients, nothing. So you're dead in the water. So we have to address those metabolic concerns up front, right? And so that's where I'm leaning into Mobilize more and more. Signal, again, I love Signal for autoimmunity. So we check for neurological autoimmunity. And if we have positive findings there, or if we're working with like an MS case or ALS or something like this, then I'm leaning into Signal more. Now, when I say that, I still have them on release. And am I still getting them on all three products if they can? Yes. I mean, there's a lot of things we're trying to do and accomplish. Everything has a price tag. So, sometimes finances are limited, or they're already taking 35 different things. And so those are variables too. But Mobilize, I love for improving circulation, microvasculature, et cetera. I love the nattokinase in it. I'm a huge fan of proteolytic enzymes. I think that's fantastic. And then Signal, I love for the autoimmune disorders, or if there's just this huge inflammatory response in the person, they need to be on that anyway. So those are my different use cases and how I navigate that.
So in your clinic, so we talked about the laser. So this is sort of your own development. So this is proprietary to you. But you're also using other technologies. Like I saw that in your clinic, you have hyperbaric chamber, you have pulse electromagnetic frequencies, you have obviously red lights in different formats. What has been, because there's a great synergy with STEMREGEN and a lot of these modalities. You take HBOT, you take PEMF, their main benefit is through leveraging stem cells in the body. So the moment you release more stem cells, then you get even a better outcome of using these technologies. So what has been your experience of blending or seeing the added benefit with STEMREGEN when using these other modalities?
Yeah, well, so you mentioned HBOT. I'll go there first. So going back to Millie's story, right? We added some hyperbaric oxygen use for Millie as well. We actually have a protocol that was taught to us by Ed Betts. He's a really smart guy. He's one that developed the unit that we use. He came in, teach my staff everything. He actually set up the whole system. I mean, this guy is amazing. But he taught us a dosing strategy where it increases stem cells in the brain. I thought, okay, so we combine that with STEMREGEN for Millie, right? So we'll give her that half a cap of STEMREGEN a couple of hours before she gets in the chamber, before we start working with her in the office. Again, just to increase the endogenous production of the stem cells. Great way to pair it with hyperbarics, in my opinion, and we've seen good progress with that. Going back to the story of photobiomodulation, right, we know that certain wavelengths of light will help to home cells and will also help with differentiation of cells. So again, if I'm working with the brain, I want to fire these networks before I use a laser on them, right, to increase my specificity, increase my targeting of those networks. It just so happens that certain wavelengths of light will help differentiate those cells into neurons. And so obviously it makes sense if we're trying to regenerate, trying to rehab a brain, to increase your own endogenous production before we start doing therapy. That way we're activating the networks, doing our therapy, doing our rehab strategies, but there's more cells then that are migrating into the area, and I'm using the wavelengths that's helping those differentiate into neurons. So that strategy is huge. And then, with different electrical strategies like PEMF, I know Dr. Jerry is a big proponent of PEMF. I love it as well. And that's a great synergistic component with STEMREGEN. Great for chronic pain. Great. I mean, really, take your STEMREGEN, lay on a PEMF mat. The results are phenomenal and better than if you just do the PEMF alone. I do absolutely love SoftWave.
What is SoftWave?
SoftWave is a more advanced form of shockwave therapy. So shockwave...
sound? Is it sound?
So there's an acoustic version, but then the version before then was mechanical. And so there would be this mechanical movable piece that would fire and then slam into a component part, and then that energy force produced would go into the body. Well, it hurts, right? I mean, you're just sitting there, bam, 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 right? It hurts. So I'm not going to use that on the brain. It's going to cause, micro traumas and whatnot. So I don't use it on the brain. The acoustic version is better, but then SoftWave actually produces a burst of plasma. So you get this bright explosion of plasma out of this head that they created, and it goes through fluid, right? And so as light slows down, it creates an acoustic wave. So this is literally lightning and thunder is what it is. That then produces a shockwave. And so we actually have a brain protocol that we've developed over the past year that's very effective. And one of the effects of using SoftWave and producing these shockwaves is you get an increase in local stem cell production. So again, okay, if we're getting this effect and influence on stem cells, very targeted, well, let's increase our own endogenous supply. And of course, we get better results, right? So I love pairing it with SoftWave. I mean, essentially, I think the take-home message is whatever you're doing, right? Whatever modality you're doing, you're using in your practice, if you pair it with STEMREGEN, you're just going to get better outcomes.
So if we summarize everything that you've shared, you just started there. Mm-hmm. Stem cells are your repair system. Whatever you're doing, just put more stem cells in circulation, and they will be leverage for repair. Mm-hmm. If you want to give somebody, you want to get good compliance, and you want to make sure that the person gets something out of it, you make them commit for 3 months. So it's not a long-term commitment. You commit for 3 months, and a lot of them, after 3 months, they'll just want to stay on it.
Yes.
And if you see any sign that there could be some deficiency in microcirculation, then you couple it with Mobilize.
Yes.
And if anybody has any sign that there could be some form of autoimmune issue in the body, you couple it with Signal.
Yes.
How often do you use the three of them, like STEMREGEN release, Signals, and Mobilize together? Do you start like your adult population on the
Yes.
the three? Okay.
Yeah. So if someone comes in with like a mild to moderate TBI, absolutely, boom, there you go. And I think that's probably the ideal scenario. Again, if finances are limited, if they're trying to do all these other things at once, then I make sure to get them on release. And again, if blood flow is a problem, then I'm pretty stern about the Mobilize as well. But yeah, ideal scenario, we start them on all of them. In the pediatric population, for Signal, we might start them on like half a tab ground up, mix it in some yogurt or something like that. Older kids, 1 to 2 tabs, if they can swallow, great. If not, grind it up, put in something. Yogurt seems to be the best medium for that demographic. But yeah, that's exactly how we do it.
In kids like Millie, I'm thinking, and this is based on, again, I don't have clinical experience, but based on other clinics that we're working with in Europe, you might even want to try to go to this half a capsule more than once a day. You could even go to up to like to 2 capsules in a day.
Nice. Okay.
Yeah, and then just see what happens, because we've seen the big step when you start. We know it's dose dependent, so we've seen this. I mean, it's not documented in a study, but 25 years of working with these plants, it is definitely dose dependent. Not so much more taking more at once, but taking more throughout the day, so that you send these waves of stem cells. We've seen it, so it would be interesting for you to try it and see if you see further improvements. Anything else that we may have forgotten?
No, I mean, so you tell me. So time frames. So if I take 2 capsules right now, what's the time frame to see that peak benefit?
The peak benefit, I mean, it's so dependent on the protocol that we're using. So let me blend all the information that I have. We know that stem cells, once they're released, will be in your bloodstream an average of about an hour. So anywhere between 6 minutes to 6 hours. So it's really a transient residence in your bloodstream.
Okay.
They are released. They either migrate into a tissue or they go back to the bone marrow. So they don't stay there forever. Mm-hmm. So the very fact that you always have stem cells in your bloodstream is the proof that you're releasing stem cells all the time. So it is a very natural process in your body to release stem cells. So how many you have in your bloodstream today will dictate how well you can repair, because it will, like more stem cells in circulation, more are available to migrate wherever there's a need for tissue repair. So the idea is to send several waves throughout the day. So I would say that, and we have cases, we have a case of somebody who had an injury. He was opening a floor with a round saw, and the saw bounced and landed on his thigh.
Oh, no.
So you got this huge gash. It's a round saw. I mean, it's like torn tissue, about 10 inches long, about an inch deep. So it's muscles, skin, connective tissue, everything is torn. And he started to take 2 capsules every other hour. And he would do this throughout the entire day. So he was told it would take him 4 to 6 weeks before he can stand on that leg, another 4 to 6 weeks before he can walk normally. And after 8 days, he was standing on that leg. And after 2 weeks, the scar was like this very fine scar, probably better than most C-section. A little bit of yellowness still on the skin, but he was able to walk on that leg.
Wow.
It just as a testament to simply say, if you do have more stem cells in circulation, your body will utilize them for repair. Our point of reference for repair is our life. And you have X number of stem cells, and that's just your point of reference. The moment you boost that number of stem cells, your body will experience like a completely different level of ability to repair. So I would think that the best way to tap into a product like STEMREGEN Release is just to take it more often during the day, to send more of these waves of stem cells rather than more at once.
That's amazing. Okay, so I didn't know. I'm going to start trying this with patients. So I can start having people do 1 or 2 tabs or capsules every hour, every 2 hours. Something. So I haven't tried that strategy yet. I like it. I think this is a really cool strategy.
I mean, up front, when there's an injury, or I will even go as far as to say, whenever you do a laser treatment that has high impact, if you're on the nervous system, on that day, maybe you take the patient now and you just say, okay, 2 capsules and scale them up, let's say every 4 hours during the day. Something like that. I'd be very curious to see what you see.
Well, we're going to start doing it. One question comes to mind. Eczema. It's hard. It's a hard condition. So many people have, and there's so many variables, whether it's gut, it's autoimmune, it's all these different things. Do y'all have any kind of stories coming in on eczema?
We do. But like you said, what I'm going to tell you, there's a huge caveat, meaning the story of that person could be like so different from the story of a lot of other people, because it's very multifactorial.
Sure.
There's a huge emotional component, if you want, with these kinds of conditions. But we have seen, for example, we have a professor at University of the Philippines in Manila, and I was working with a doctor in oncology, a surgeon, and I was sharing product with him. He used it for a lot of cases, so he shared with me a lot of these cases. And that was one of his colleagues, one of his friend, who was a professor at university. He had eczema his entire life, or psoriasis, one of the two, but his entire life. Nothing could help. And he shared with him the product, and then within a matter of, 4 to 6 weeks, everything left on his body. So they wanted to do a study. So we started to plan to do a study. It did not materialize for various reasons, but here's a case. We have seen these cases, and he was a physician. So we have seen these cases over the years. We have not done any studies just because of the complexity of the nature of a condition like this. It's not easy when you want to have inclusion, exclusion criteria to just make sure that you have a population that has something like that is very homogeneous in terms of what is it that we're going to look at. There's gut issues, emotional. There's so many different things. So we have not studied it. But we have seen a number of cases over the years.
I know how stubborn eczema can be. My own kiddo, he'll get flares of it, and we have to work really hard to get him out of that flare. And then he'll be fine for a period of time, and then something happens, and it's like, oh my gosh, what happened? Was it a exposure to something? Was it his gut again? Like, it's just like banging your head against the wall. So this is something I have not had him do. And so that's why I asked. So this is something we'll start doing.
I'm not a clinician, so purely from more like reading the science, there's a lot of link with the gut and any of these skin problems. Have you ever heard of something called sangre de drago?
No.
Sangre de drago is a sap. Like, once I have some time, some freedom, I would like to go and develop that product, because it is on the marketplace, but it's not present in a form that makes it easy to really use for all kinds of application. But it's a sap that is coming from a tree called, the name of the tree is Croton lischleri. It's sangre de drago, blood of the dragon in Spanish. So you use your knife, you just strike the bark with your knife, and the sap comes out like blood. That's why they called it blood of the dragon.
Wow.
So if I put some sap on my finger and I show you my finger, you think that I just cut myself.
Okay.
So it's like blood. If you apply it on an open wound that is bleeding, bleeding a lot, within about a second or two, it stops bleeding. There's almost like a plastic film. It's like almost like the protein of the blood all coagulates, coalesce, and forms this plastic film. It stops bleeding, the pain goes away, and if you keep applying it, give it about 7 to 10 days, and it's completely healed with no scar. So they use it in the jungle for any of those sort of open wounds. But what kind of open wounds do we have in our Western society? It's ulcers.
Yeah.
So it's been applied in ulcers. So you take that sap, blend it in water, and within 10 days you can get rid of an ulcer. So I'm saying all of this because I've used it. I recommended it one day with a team that was dealing with autistic kids. but I don't think they never really followed through with it. But we know that intestinal permeability is a big issue in autism. It's a big issue in a lot of autoimmune disease, and it's a big issue for psoriasis or those kinds of skin issues. So I was just thinking, maybe give it a shot. Get some Sangre de Drago. You can go on Amazon. I think Rainforest is a company that has it. It will come blended in alcohol with, you take it with a dropper, it's liquid. I would like to do a form without alcohol. That's what I would like to develop. But you just put it in hot water. The alcohol will flash in a few minutes, and you drink maybe like a teaspoon. It has to be dissolved in water. A teaspoon in water. Do this 2-3 times a day, and I'd be very curious to see what your son experiences.
Well, I can guarantee you we're going to try it. So
I'll give you so much for that.
That's amazing. Yeah, thank you for that information.
So let's recap all of this again. So in summary, you start understanding that stem cells are the repair system of the body. Any patient that you have, you basically start release stem cells with STEMREGEN release. If you can, if they're older patients, you start with the whole protocol with Signal and Mobilize. If there's clear signs with circulation, you definitely focus on Mobilize, and you make them commit this for 3 months. And then you add any other modalities that you're doing. And you're doing this right now with autism, with epilepsy, with all, basically you do this with all your patient base.
Yes, absolutely. And we've seen just better outcomes. Really, it's a no-brainer, for us from our perspective. It's been a big game changer in our clinical observations.
And so you blend this again, understanding that we're just boosting the innate ability of the body to repair. Whatever that you're doing in your clinical setup in terms of intervention, you just add the repair system of the body on top of it, and it just amplifies what you're doing.
Absolutely.
So anything that is being used, just give it a try. And again, the best way to introduce it, make your patients commit for 3 months so that they can really see a difference of what this can do for them. And oftentimes after that, they want to stay on it because they see the difference that it's doing for them.
Absolutely.
So if you're interested to try STEMREGEN, then stemregen.co. And Brendan, if they want to connect with you at your clinic, neurosolutionatx.com, right?
You got it. neurosolutionatx.com. Absolutely.
Thank you so much, Brendan.
Thank you. Appreciate it. All right, everyone. I hope you enjoyed today's conversation. I know I sure did. It's not every day that I get to sit down with someone like Christian that's really pioneered and developed something like what he's done. And the interesting thing is, which we didn't really even get to dive into, is some of his ideas and things that he wants to develop in the future, which obviously we have a follow-up podcast that we need to follow up with. But if you know someone that can benefit from this information, please share this content. That's why we're doing this. That's why we took time out of our day. It's to help you and to help people that need it. So if you're interested in this product and you want to try this product for you or someone that you know that needs it, there is a link in the show notes. You can actually get a discount if you use this. So it'll be an easier point of entry. You can check that out, give it a shot. Please report back. Tell us about how it's going. So thank you again. Like, share, do all the things that you're supposed to do with this content. I don't even know what it is, but you know what it is. And I look forward to seeing you next time.
We hope today's episode has inspired you to take that next step toward your best self. Remember, the path to longevity is paved with small, daily decisions. Your journey is unique, and every step, every choice, brings you closer to your ultimate vision of a healthier, happier life. For more insights, tips, and resources, visit drbrandoncrawford.com.